Hi, I am Dr. Pallavi Kalghatgi, and today we'll be talking about vaginal discharge. I'm sure right from when a girl hits puberty, she is in a constant battle to figure out if the odd colored discoloration or stain that she sees in her underwear is normal or not. Well, this odd colored secretion is actually your vaginal discharge, and most of the times it is normal. But let me talk more about it. Why does a woman have vaginal discharge? So basically, your uterus, your cervix, and vagina is secreting substances constantly, and over time, these substances come out through your vagina, and that is what is called your vaginal discharge. Now, this mechanism is actually a self cleansing mechanism for your reproductive system. A reproductive system maintains or remains healthy by maintaining two factors, that is, the pH factor and the amount of good bacteria. In fact, mild infections or disturbances in your uterus or in your reproductive system are actually taken care of naturally by this self regulating process. Hormones are responsible for vaginal discharge. That is why women or girls in the reproductive or the puberty age group until menopause experience maximum amount of vaginal discharge. In fact, about 3 to 4 years before a woman hits menopause, the vaginal discharge tends to get more and more scanty. What is a normal vaginal discharge? A normal vaginal discharge is usually clear, sticky, transparent, or sometimes milky white. And the best way to understand it is it has an egg white like consistency. Now, a normal vaginal discharge can be present throughout your menstrual cycle, but it is more during the ovulation time and just before your periods. Also, experiencing a normal vaginal discharge but in excessive amounts is seen during pregnancy or during when a woman is undergoing infertility treatment. Again, the reason behind this is that the reproductive hormones are very high in the body during these times. But, however, remember that having excessive white discharge during pregnancy uh, can also mean that you have an infection or could mean a vaginal leak, which means that the amniotic fluid surrounding the baby is actually leaking from the vagina, and this kind of condition needs instant attention. Sometimes having a pinkish or a light red discharge just before your period is also normal, and that is usually what we call as spotting. And even during your periods, when if you have a dark red discharge or a brownish discharge followed by a bright red discharge, that is also normal. But remember, if you are having a blood tinged discharge or a period like discharge somewhere between two periods, between the time frame of two periods or immediately after intercourse, that is a condition that needs further evaluation. Sometimes a woman experiences excessive transparent watery like discharge which may also be sticky when she is sexually aroused, and that is also normal. Now, let us talk about some of the abnormal vaginal discharges. But before I talk about that, let me list down some of the alarming signs associated with the vaginal discharge. So, if a discharge is associated with foul smell, if it is associated with itching or burning sensation, if it is associated with a fever, that is abnormal. Also, having odd colored discharges like greenish or yellowish, or having curdy like discharge, or like I said, having a blood tinged discharge between two periods or after intercourse. Abnormal vaginal discharge associated with painful intercourse is also an alarming symptom. Now, it is always good to understand what is normal and what is abnormal. But remember, do not self diagnose or self medicate when you feel that something is normal. It is the best way to handle an abnormal discharge is to go and visit your gynecologist. Now, many a times you get a curdy white discharge like paneer like, or it falls like white chunks, and that is suggestive of a fungal infection, also called as candidiasis. And antifungals in the form of tablets or a pessary like a vaginal insert or creams can be prescribed. Sometimes you have a greenish or a yellowish discharge that is associated with a burning sensation or a foul smell, and that is suggestive of a chlamydial or a trichomonal infection, which are in fact sexually transmitted diseases, and that definitely needs further evaluation. Sometimes you have a grayish frothy like discharge which is associated with painful intercourse, and that could mean you have a bacterial infection, and a thorough course of antibiotics may be necessary. So now these were some of the basic abnormal vaginal discharges, but and that was about today's video. But before I end the video, let me quickly talk about some of the ways where you can avoid developing an infection, a vaginal infection. So firstly, and most primary, is using condoms during intercourse. So condoms not only act as a contraceptive method, but they also help to prevent the transmission of sexual diseases. Also, after intercourse, it is always a good idea to pee or pass urine, which actually helps the flushing out of bacteria if present, and also cleansing with plain water after intercourse will also help. During your regular cleansing routine of your intimate parts, remember you can use a mild soap or a diluted cleanser just to clean the external vulval area. Do not use soaps or intimate washes inside your vagina, because they actually disrupt the pH levels and destroy the good bacteria that are present, and it leaves your vagina more prone to infections. Another important point is, do not use perfumes or deodorants or talcum powders down there. Okay, your vagina is not meant to smell like lavender or some fragrant mist. Your vagina has an odor, and that is absolutely normal. It is just like when you sweat, your body gives out an odor, and you do not need to get rid of it, because it is absolutely normal and it is something you have to accept. As long as you maintain a hygiene routine, a healthy hygienic routine, and a basic cleansing routine, you are absolutely fine. So that was about today's video and today's talk. Remember, when you are in doubt, you must visit your gynecologist, who is going to take a detailed history about your symptoms, and who is going to examine you and evaluate you and treat you only and only if necessary. So thank you for listening, and have a good day. Bye bye.